Hello, Chris Grimman, Omaha Insurance Solutions. Many people have Medicare Advantage plans or Medicare Part C. Medicare Part C is Medicare. Sometimes people get that confused, but it's Medicare. Medicare administered by a private insurance company approved by Medicare, also called Medicare Part C. Now, with Medicare Advantage plans, usually the way it works, there are minimal copays, maybe some deductibles, coinsurance, up to a maximum out-of-pocket. With original Medicare, traditional Medicare, sometimes people call it, if you don't have a supplement, there's no maximum out-of-pocket for the A or the B. So one of the advantages of Medicare Advantage is that maximum out-of-pocket. But you still have various copays up to, again, depending on your plan, it could be $3,000, $5,000. The most your maximum out-of-pocket could be $6,700. Now, the copays that people see on their Medicare Advantage plan, sometimes that gives persons concern when they're looking at whether to go on a Medicare Advantage plan compared to a supplement, or if they're on a Medicare Advantage plan. And what I've seen happen is sometimes people will get what's called an indemnity plan, a hospital indemnity plan. What that is, it's a separate insurance policy, and the way it works, there's all kinds of varieties. The way it works is if something happens, let's say you go to the emergency room, let's say you're admitted to the hospital, let's say you have cancer or a stroke. When you have these various things in the policy, it'll state if you go to the emergency room, they will reimburse you $150 each day you're in the emergency room. That might be an example. Or let's say you get cancer, and in this particular policy there's a lump sum of $10,000 that is passed on to you once you contract cancer for the first time. Or let's say you have a stroke and you're homebound, and so home health care is coming to your home, and the policy you have allots $100, $200, $300 per day to go towards whatever you want, because it's cash coming to you. You can use to help pay deductibles, copays for nurses, housekeepers coming, or simply you pocket the cash. But most likely when something serious happens, there's all kinds of expenses, whether medical or otherwise related, and there never seems to be enough money to cover it. And so an indemnity plan, you pay a small premium, and then you are covered in the things that are laid out in that particular hospital indemnity plan. It's something certainly to look at, especially if you're going in the direction of a Medicare Advantage plan. Or you may think to yourself, well, there's been a history of cancer in my family, a history of stroke, that sort of thing. And so an indemnity plan, they may focus particularly on cancer or strokes or heart attack, that sort of thing may be of interest to you. Give us a call here at Omaha Insurance Solutions. We can show you the various plans that are available at low cost, and you can consider them in your overall healthcare plan. Thanks for listening, Omaha Insurance Solutions.